Toothbrush is a mechanical method by which you can remove the local factors or the plaque and calculus that gets deposited on the tooth surface. In earlier times, we used to use mango sticks, chew mango sticks or use charcoal to remove this plaque and calculus deposits or the local factors as we call it.
People used to use neem sticks and all those kinds of twigs. Those are very harmful because you can't control the amount of pressure. It also strips the gingiva.
So that there are various bristles on the toothbrush. You have a different specification. At the same time, you have different hardness of bristles. You have soft, medium and hard. And I've heard a lot of patients telling me that if you use a hard bristle toothbrush, the efficiency of cleaning is better. But invariably you see that they are causing deterioration on the tooth surface on a long-term basis. So ideally we would advise the individuals to use a medium toothbrush, and that depends on the diameter and length of the bristle. So you have a specification for that. And soft is normally used for disease when you have a periodontal disease progression and you have soft, or a patient has underlying diabetic disorder, or when you have soft and puffy gums, and those who have undergone periodontal surgeries. After that, you advise the use of a soft toothbrush. On a regular basis, we will always advise the use of a medium bristled toothbrush. And again, all these three are detrimental if the technique of usage is different. Like in the sense, if it is not used in the right manner, all the three can be detrimental.
The only single rule for a toothbrush is buy a simple toothbrush which has rounded bristles and which is soft. Medium and hard toothbrushes I would not recommend for brushing your teeth.
Yeah, so I think hard toothbrushes should be avoided because it's not supposed to last. If it's supposed to last, that means something has to abrade. The harder the toothbrush, the more tooth structure is going to wear off. So you would rather use a soft brush and repeat it more often than using a hard brush that's going to last 3 months.
A lot of people like to use the hard brush because it makes them feel good. They feel they've done something. But little do they realize that they're taking away a lot of that tooth structure. All the enamel, the protective layer, etc. By the time they realize, it's probably too late and they need major restorative care.
I would recommend that please carry the toothbrush that you are using to your dentist. He will advise you on hard, medium or soft bristles. He will advise you on the type of the head, on the size of the head of the toothbrush.
A toothbrush aids in the cleansing of the entire oral cavity on the tooth surface as well as on the tooth gum margins. Again, technique of toothbrushing is very important.
It is not about how hard you brush. It depends on how well you brush and the right technique we use for brushing. So ideally we need to use a soft brush with less force, and the cleaning has to be done on all the areas. And specifically you should not brush on one specific area for a long time, which could cause what is known as abrasion of the teeth. There could be more wear and tear of the teeth if you use excessive force on a specific area for a long time.
Toothbrush has to be held at a particular angle, and you have to brush up and down along the long axis of the tooth, and avoid horizontal brushing. You have to brush all the surfaces on the outer side which is visible in the mouth, which is visible to everybody, on the side of the tongue and on the side of the palate and on the biting surface. All surfaces must be covered. Any surface which is not accessed by the brush.
Well, it's not the time as much as the way, the direction of brushing. If you are going to go to and fro where you are supposed to go vertical, then you could be damaging your teeth or the gums.
Too much toothbrushing is people who are paranoid about maintenance or cleansing their teeth. They always feel that there is some remnants of food that is remaining back on their teeth.
So on one side we have people who never brush and never take care of their oral hygiene, and on the other flip side you have obsessive people who tend to brush after every meal, after each thing they eat or drink, or they brush for 10 minutes, 15 minutes, And so my advice to all these people is that there is a protocol that we all need to understand, that too much is too bad.
We as dentists advise to the tune of 1.5 minutes to 2 minutes, that is about 90 seconds to 120 seconds. But the average response from patients is they don't last beyond 60 seconds. So restrict to around a minute, minute and a half to 2 minutes, not more.
So that is after your night dinner. You give it some time, and normally you have dinner, you wait for 2 hours before you get to bed. So just prior to bedtime is the ideal time to brush.
Every time you have a meal, you should at least rinse your mouth, and twice a day is ideal for brushing. But if your intake is not as much, if you're eating a lot of fibrous foods, not too much of calories, not much of caramel, you can just brush once a day and that's more than enough. But if you can supplement with flossing, that would be the pinnacle of maintaining your health. If you brush and floss, you can keep your teeth for life.
Why do we need to brush in the morning after we've brushed the last thing at night? After all, we haven't eaten anything after that. So after, what happens after you've brushed at night, you're not eating anything, so there's no flow of saliva. Saliva flows when you've eaten something. The body reacts and it sends saliva to digest that food. So you've not eaten anything, so it's stagnant. This oral cavity is stagnant. So the thick layer of mucus forms on your teeth, which may be perceptible to you or may not be perceptible. So it is important to get rid of that plaque layer before you have anything in the morning, because that plaque layer is full of toxins in a concentrated form. So it is very important. Don't think you can get away by brushing you brushed at night, so you need not brush in the morning. That does not apply for sure.
Somehow we are attached to a toothbrush very emotionally. We may discard other possessions but not the toothbrush, right? But ladies and gentlemen, please ensure that you change your toothbrush every 3 to 4 months, or whenever there's a flaring of the bristles of the toothbrush, because a flared bristle is no good to take care of plaque and debris removal on your tooth surfaces.